It's official. Trump has imposed new rules on covered California Affordable Care Act health insurance plans and the subsidies to make those plans affordable. Hello, I am Kevin Knaus with InsureMeKevin.com, an independent health insurance agent in California, and also a certified covered California agent. And several months ago, the Trump administration proposed new rules for the Affordable Care Act, and they have gone through the process and now they have been approved. Now, it isn't Donald Trump that actually made these proposals, rule changes. It was Dr. Oz, because he leads the Center for Medicare and Medicaid Services, CMS, and that is the federal agency that writes the rules for the Affordable Care Act that applies to covered California enrollments and how people get their subsidies. And some of the rules that were proposed have been changed. Part of that applies to the state-based exchanges. So Covered California is a state-based exchange and they operate slightly differently, and so some of the rules were kind of modified for those state-based exchanges. So if you read in the paper one rule that may not completely apply to Covered California because we operate a little bit differently. But the first rule is the past due premium repayment rule. So what that says is that if you return to a health plan and want to enroll in it, if your health plan was terminated for non-payment, then you have to repay those past due premiums before you can enroll in the plan again. So the scenario would be that someone is enrolled in a health plan, they stop making their health insurance premium payments, say in October, and so the plan is canceled. Now, open enrollment comes around. If they want to go back into that plan, the carrier can demand that the member repay those months that were terminated for non-payment, October, November, and December. And they have to make those payments before any funds for the new enrollment of the health plan will be attributed to the new plan. Some of this will be limited by state laws on how far back someone can go. Some states, they may allow the carriers to demand 6 months of repayment. The whole thing seems odd to me because health insurance is a month-to-month kind of contract. So if it's terminated for non-payment, you're not covered for that month. You can't file a claim because the health plan was terminated. So, it's like your auto insurance. It was terminated. You can't get it reinstated. So why should you have to repay a past due premium where there was no coverage? The workaround solution for some people is that this won't apply if you select a new carrier. So maybe you were with Kaiser and you, for whatever reason, no fault of your own, the coverage lapsed. Maybe you had a problem with the credit card. And Kaiser's, demanding back premium payments. Well, you can enroll in Blue Shield, Health Net, Molina, or whoever else is out there. And so we'll see how all that runs, but that's one way to get around this repayment of past due premiums. DACA, Deferred Action for Childhood Arrivals. Their enrollments will be terminated at the end of August. And the whole reasoning was that DACA young adults are not lawfully present. Now, I was on the call where the CMS people were going through all of these updated rule changes, and I kind of got a feeling there was a smile on their faces when they were talking about terminating the DACA enrollments. It just makes no sense. I mean, okay, not lawfully present, but gosh, they've enrolled. At least let them finish the year. They're going to be terminated at the end of August. That's just cruel. That's just sadistic. And it provides some of these people a perverse happiness at CMS to rip health insurance, health care away from people. The next rule, failure to file federal income tax return. So if you had not filed for the last 2 years, Covered California could, give you a pass. I'm going to file. You could do the tax filing attestation and continue forward. No more. You can only have not filed with the last year, but if it's 2 years, you're not going to get the subsidy. So that just says you need to file your taxes. I know people get extensions and things are difficult, but that's what it's coming down to. If you haven't filed your taxes for a couple of years, you're not going to get the health insurance premium subsidy. There are some rules that are directed at folks that have low income or no income tax data, federal tax returns. There's going to be additional scrutiny on households where the income's below 100% of the federal poverty level, and that is technically Medicaid in many states. In California, if you're below 138%, you're Medi-Cal. But I guess CMS is going to request that the states do more income checks and start to look at those individuals whose last federal tax return had an income under 100% of the federal poverty level for the household size, but they're estimating an income higher than that. Because there are some people, there was a report down in Florida where a lot of people are doing that in Florida. They're kind of artificially inflating their income so they can get the subsidies and be in a better health plan. For those individuals that have no federal income tax data on file, they are not going to allow people to attest to their income estimate. So this might apply to a young adult just coming into the workforce, did not file taxes in the last couple of years because they made very little. They're going to school. Now they have other income. And what we have been able to do is file what is called an income attestation form. You are attesting that the estimate is good, faith, honest estimate for your income. They're not going to allow that if there is no federal income tax data and the income cannot be verified by other sources. So your people are going to have to present hard documentary evidence to prove what their income is. And that might be a hurdle, especially for self-employed individuals. Another rule is the $5 premium rule. So for some consumers, when they enroll into a health plan, the subsidy is larger than the health insurance premium for the plan that they're enrolling in. So it's $0. They're not making any monthly payment. Okay, now come open enrollment time, those folks that are being re-enrolled into a zero-cost premium health insurance plan have to go into their accounts and confirm that the data is accurate. If they don't go in and, I guess you could call it actively renew the health plan, they will be subject to a $5 monthly premium. And they have to pay that, verify their information, and then that $5 will go away. And there's only going to be a 2-month grace period. So if someone's not paying attention to their mail and I'm not paying $5, it's $0. And come March, then the health plan will be terminated. So part of this comes from the folks at the Trump administration. They have their perspective is that everyone is trying to cheat the system. Everyone is trying to get federal dollars, and their mission is to save money, not to help people get health care, but to save money. So they are approaching all of these rule changes with the attitude that people are liars, they're cheats, they're trying to game the system, and they want to prevent that. It really could be that someone has a $0 premium health plan because they have very low income. So that's going to be, so you need to pay attention with that coming down the line for 2026. Open enrollment will not change in California from what I've read for the 2026 plan year. We'll still have an open enrollment that is fairly long and give people plenty of time to look at everything. This is kind of the state-based exchange, kind of a modification. However, in 2027, Covered California must go to a 9-week open enrollment period, which means they might open it up, mid-October and close it December 15th, and all plans need to be effective January 1. There will be no more enrolling in January with a February 1 start date. Again, the people at CMS and the Trump folks, you're gaming the system. All of a sudden you stubbed your toe in January and you're gonna go get health insurance and then drop it in March after you get your toe fixed. I don't know. I don't know what's with these people. They just really believe we are all unethical and dishonest. There was a special enrollment period if your income was less than 150% of the federal poverty level for your household size. That is being eliminated. That was something Biden put in because just a lot of low-income people, they're scrambling, and this gave them a way to get into health insurance. Sure, they only thought about health insurance when they did have a health care scare, but better to get them into the system than to have them rely on emergency room services, which are very, very expensive. And of course, most low-income people cannot pay the bills from an emergency room care, so better to have them enrolled in a health plan. But that special enrollment period during the year is going away. The special enrollment period, if you were DACA, is also going away. So all of the DACA people are just kind of being cut out. The Trump people don't want to see them. They just want to deport them. They don't care if they're doing critical work at a company. They just don't care. So those are kind of the new rules, the updates that will be applying to Covered California moving forward. So some of them are applying now in 2025. Some of them will come into effect in 2026. So the takeaway is people need to be alert. You need to read the letters that are being sent to you from Covered California. They will have specific information in there that may be applicable to you. Instructions on how to make sure you keep your plan, if you need to change plans, if you need to actively renew your plan, because this is kind of a shift. And people in Covered California, agents included, we are used to doing things the way it has been for the last several years, but now things are changing. And if we're not on top of it, people may lose coverage, and the Trump folks, they're not going to cut you any slack. They're just going to cut you off. So if you have any questions or comments, you may leave those down below, and I will do my best to answer them with as little sarcasm as possible. So for InsureMeKevin.com, I am Kevin Knaus.